Many aspects of bipolar disorder have been investigated over the past several years. But I think one area where we have seen significant progress is in the area of treatment of bipolar depression. Because when we think about bipolar disorder, the first thing that comes to one's mind is mania. But when one looks at the longitudinal course of the illness, it's depression that seems to pose the most burden for the disease. Up until 10 years ago, we had very few effective treatments for improving depressive symptoms in bipolar patients. In the last 10 years, we've had 4 new medications, and these are all called atypical antipsychotics that have been proven to be effective in improving depressive symptoms. And all these medications have been approved by regulatory authorities around the world. And one of the interesting things about these medications is that their safety tolerability profile is also better, particularly some of the more recent ones such as cariprazine and lumateperone, which do not seem to have any metabolic effects, and yet they seem to be very effective in treating depressive symptoms. And the other 2 that have been approved are quetiapine and lurasidone. Now, the other exciting thing about the treatment of bipolar depression is that there's been a lot of interest in terms of the role of psychedelic medications. And there is some emerging data suggesting that medications such as ketamine, cannabidiol, and even psilocybin have been shown to be effective in preliminary trials. And we're actually now starting 2 large double-blind trials, one looking at the CBD, the cannabidiol, other psilocybin, to confirm the efficacy of these treatments. Other area where there's also been some exciting development is in the area of neuromodulation treatments, because ECT works very well for treating depression bipolar patients. But of course, there's stigma, there are side effects with ECT, and people have been using transcranial magnetic stimulation for major depressive disorder. And more recently, there's been some emerging data showing that accelerated TMS protocol using theta burst stimulation is very effective in improving depressive symptoms in bipolar patients. So I think overall, the good news is that one area of bipolar disorder where we've had significant unmet need, and that is treatment of depression, there has been a lot of progress. And I think looking into the future, there are a couple of areas that I'm very excited about. One is figuring out personalized treatment. Now that we have a number of treatments, how do we determine which treatment works the best for what patient? So really trying to discover biomarkers that predict treatment response for each person. And the second area, I think, is the early intervention. Because we know that bipolar illness is a lifetime illness. And the idea is that if we diagnose early and intervene early, maybe one can improve the outcomes. And the other area that I'm excited about is identifying people that are at high risk for bipolar disorder and coming up with interventions that hopefully will prevent them from ever developing bipolar illness, which could transform care for these people. So those are the areas I'm most excited about. Hopefully we'll make some headway in those areas as well.